Commonly used is the forceps. Here we have toothed forceps and non-toothed forceps. You have long and short. Okay, the small tooth forceps is others called adjacent, and small non-tooth forceps is also adjacent forceps. The tooth forceps causes less damage to the tissue because it can easily pick up the tissue, whereas the non-tooth forceps crush the tissue more. So it is used only when needed for very sensitive tissues like the nerve. When you don't want to actually hold it strong, but you just want to manipulate the nerve a bit. And coming on to the scissors, this is the Mayo scissors and this is the Massenbaum scissors. Mayo scissors are slightly broad and flat, and this is a curved Mayo scissors used for dissecting tissues with a blunt tip. These are Massenbaum scissors. They are narrow and long. This is a curved Massenbaum scissor. This is a straight Massenbaum scissor with blunt tip, and it's a curved Massenbaum scissor with a blunt tip. All are used for dissecting tissues. This is a suture cutting scissor. The shape is specifically made like this in order to pick up the suture under one of the blades and cut it. This is a sponge holding forceps, to pick up a sponge and for preparing the area. These are mosquito forceps or small hemostats. This is straight small hemostat or straight mosquito, and this is a curved mosquito or a curved small hemostat. This is a long artery forceps or a hemostat forceps. This is straight and this is curved. This is also a curved artery forceps. This is a long straight artery forceps. Okay, and we will go on to the needle holders. This is a needle holder. If you see the difference between the straight artery and the needle holder is more stout and more strong in order to be able to manipulate the needle into the tissues. This is a cocker. Cocker is for holding the tissues very hard, strong and manipulating it. This is straight cocker and this is a curved cocker. Okay, these are the Alice forceps. In order to take hold of tissue, usually a fascia or a tendon, it has serrated edge that articulate with each other in order to hold the tissue strong. And this is again a curved long cocker. This is a straight cocker. This is a barred park knife handle in order to fit knives of various shapes and sizes for the surgery. Here you have the Langenbach retractor. You have options of deep and small, broad and small. This is a bone nibbler. This single axis, this double action. Single action bone nibbler and double action bone nibbler. It's used for nibbling away pieces of bone. This is a bone cutter. See, if you see the bone nibbler is shaped something like that, you have a scoop sort of tip, whereas in a bone cutter it's more flat and sharp. And this is a double action bone cutter. This is a curette. You have a rounded part and a more oval part. This is for curetting away infected surfaces or fracture surfaces, blood clots of fracture surfaces, or in case of non-union, fibrous tissue from fracture surfaces. This bone lever is used to move away the tissues from the bone. For example, you have this as the bone, you just clip the bone lever. After you make an incision on the periosteum and elevate the periosteum with the periosteum elevator, you slip the bone lever under the periosteum and remove the tissues away from the bone. That way you can export the bone and make sure that you don't have some major vessels or nerve under the bone before you use a bone lever. For example, in an anterolateral approach of the humerus, don't use a bone lever too deep. You could damage the radial nerve. This pointed bone holding clamp this pointed bone folding clamp, big one and small one. The difference between a tower clip and a pointed bone folding clamp is the bone folding clamp points towards each other, whereas the tower clips point slightly away from each other in order to pinch the tower. This is again a bone folding clamp. It's a bird beak plate folding clamp. It has two surfaces. One surface allows the plate to be held against. It's shaped in such a way that you can place the plate on the bone and hold the bone and the plate together after you have reduced the fracture before you place the screws. This is a plate bender. There's the plate. Yeah, this is a plate bender. So basically, you use the bender in two different directions like this in order to bend the plate in either direction. Okay, so you have a more narrow slot for the 3.5 plates and more broader slot for the 4.5 plates. Okay, so this is a sleeve. When you use a drill bit on a bone and you're using a more minimally invasive approach, you use a sleeve in order to protect the soft tissues from the drill bit. Okay, so this is the drill bit sleeve, and this universal sleeve used for both central for making hole in the center of a DCP hole or in an eccentric way. The arrow has to be pointing towards the fracture so that the drill hole is made away from the fracture in order to achieve compression at the fracture site. Okay, so this is a depth gauge. You have a small hook on the tip of the depth gauge. After making the drill hole, you put the depth gauge through the drill hole, hook it on the undersurface of the bone, and then push the upper part of the depth gauge. And once it is done, you have a measurement there, and that is the length of the screw that you have to take. Okay, so the hook on the tip of the depth gauge allows you to go through the drill hole and then hook on the undersurface of the bone, and then you push this part and make a measurement of the screw length. This is cannulated T-handle shaped screwdriver. This goes with a thin K wire. This is a guide wire. Okay, fine. This is a bone saw used along with the electric saw. Okay, this is a periosteum elevator. This is an osteotome. These are all osteotomes. This is a chisel. And this is a chisel. I will tell you the difference. See, first of all, in the periosteum elevator, you have a thumb rest. Okay, so this is one way in which you can identify which is a periosteum elevator, and it is more curved. So basically, once you have made an incision on the periosteum, you just place on the incision and elevate inch by inch. This is an osteotome. It is beveled on both sides. So this is a narrow osteotome, this is a broad osteotome, and this is a medium osteotome. It is used for cutting bones. This is a chisel. It is beveled on one side but not beveled on the other side. This is a straight chisel and this is a curved chisel. It is used for taking off growths from the surface of a bone. Or for example, you have done a plate removal and you have extra bone, then you chisel off the extra bone from the surface of the bone. It is not used for cutting bone. Osteotome is used for cutting the bone. So you have the drill bits here of various length and size. What I mean by size is the thickness of the drill bit. So for example, for a 3.5 system, you use a 2.5 millimeter drill bit or a 2.7 millimeter drill bit. And for a 4.5 system, you use a 3.5 millimeter drill bit. And here you have cables of various thickness. you have in 1 millimeter, 1.2, 1.5, 2 millimeter KOS. This is a combi hole plate. You have dynamic compression holes, and also you have locking holes. The locking hole, the inner part has threads that locks the locking screw head to the locking hole threads. So once you have drilled the bone and you have made assessment of the depth of the drill with the depth gauge, then you go in with the tap in order to create the threads before you insert the screw. This is not needed for a self-tapping screw. However, if the bone is very strong, then you have to at least make an entry hole with a tap so that it becomes easy for you to push in the screw. And this is a regular screwdriver. Like previously I showed a cannulated screwdriver. And then here you have the self-retaining forceps in order to push away the soft tissue, especially when you are short of an assistant or when you have a minimally invasive procedure, when you want to push away the tissues and do your procedure with minimally invasive incision. For example, you're doing a mini open rotator cuff repair. You want to make an incision in the deltoid and push away the deltoid fibers and go inside and expose the rotator cuff. That is when self-retaining forceps is very useful. And here you have the mallet. Useful for most orthopedic procedures. One small tip with the mallet is never make, this is not an instrument for the mallet, but I will just show. Never make single taps, uncontrolled taps. It's easier and more controlled to make double taps in a controlled way. And one particular point I would like to make here is the way to hold a forceps is to have your ring finger in one of the ears and the thumb in the other ear, and have the remaining two fingers supporting the artery or needle holder. That way you have very good control of the instrument. This is not the way to hold the instrument, and this is not a good way to hold the instrument. Have the ring finger in one of the ear and thumb in the other, and have it supported with the other fingers. Okay, thank you.